You are unmuted.
All right, could I see counsel at sidebar, please? All right, so let's bring the jurors in, please.
Please be seated.
Good morning, jurors. So, an issue has come to my attention that is going to make it necessary that I talk to each one of you individually over at sidebar with counsel. So that process will take a little while. So I'm going to don't speculate as to what I'm going to talk to you about. Please, when you go back to the deliberation room, talk about anything but this case, and I'll see each of you individually. And the process may take the cameras will be shut off, and I'm going to talk to the lawyers about whether no filming. All right, send you back, and we'll get you back. Thank you very much.
Talk to the guy, please.
All right, now I'll see counsel.
Hey, good morning, everybody. Can you hear me? I always like to come in soft because I don't want to shock everyone while you're sitting there watching a fan. Um, there we go. Yes, you can hear me. Okay, great. um, we're getting ready this morning, getting prepared for the little ones to wake up and bring their storm of chaos with them. And we've got the trial on in the background, obviously. We hear this announcement from Canton, and yes, I'm watching. We've got the fan on. That is live, even though the fan's not moving. They must not be having hot weather there in Canton, but we will definitely keep an eye on the live feed so that you're not going to miss anything, because I know this is kind of crucial stuff happening this morning. And Tiffany turns to me and she goes, "You got to go on. You got to go on and tell people what's going on." And I go, "I don't know what's going on." This kind of stuff doesn't happen. This is, listen, let's not lose our minds. I don't want to get all hyperbolic about the whole thing, but this kind of stuff is very bizarre. Something very crucial had to have happened for the judge to stop the proceedings. Is it unusual for judges to question jurors in the middle of trial? It's not outrageously unusual. I've had it happen to me several times. Something comes up, a note gets passed to the judge. Juror so and so is, talking about the case to others, or juror so and so is maybe a juror has a question, maybe a juror's scheduling issues, whatever, and the judge will usually break at an appropriate time, bring in that juror or the concerned jurors outside of the presence of the other juries and question them. So it's no surprise here that we're doing it that way with the other jurors back in their room, and the cameras off and the judge questioning everybody outside of the view. This is not considered public. They would, oftentimes a judge might even bring people back into their chambers to ask questions like this. What's bizarre here is that she stopped it dead in the middle of everything they were doing. And I know they were just getting started this morning, but it was important enough for her to not say to the attorneys, whoever called for this sidebar and raised this issue, or if it wasn't even them, by the way, it could have been something that was raised to the bailiffs, or it could have been a note passed to the judge. But whatever issue was raised at sidebar, and we're just speculating here, so forgive me if I'm completely wrong, but my guess is that whatever that issue was, it wasn't something where they felt comfortable continuing with testimony until they found an appropriate time to break. It was something that needed to take place now. The other takeaway I think you can take away from this is that whatever it is, they don't know which juror it involves, or maybe it involves multiple jurors. But it sounded to me, unless I'm wrong, correct me, everybody, it sounded to me like it was an issue that required the questioning of all the jurors. So perhaps it was something said or done that they want to know, did they witness? Perhaps it was some sort of misconduct, absolutely, and they want to know how far did that misconduct go. If a juror has been behaving inappropriately, doing something inappropriate, getting information, communicating with attorneys, whatever it is, has that remained with that one juror? Has it moved on to other jurors? So usually I would say it's safe to say whatever this is serious enough for the judge to want to halt everything and get to the bottom of it. Now, is it serious enough to cause a mistrial? That is absolutely anybody's guess. I mean, it could easily be be prepared for this, by the way. We come out of this and know nothing. They take us off the fan. It goes to Canoni. She brings in the jurors and she goes, "Thank you everyone for your patience. Mr. Brennan, you're your next witness." And we know nothing moving forward. No one's dismissed, no disciplinary action, no instructions, nothing takes place, and we move forward. That easily could happen. Or it could be a juror's dismissed and replaced without comment from the judge. Juror so-and-so is no longer with us. We've randomly picked juror whatever. You're now up. Or I guess they don't replace them here in Canton or in Massachusetts. They kind of wait to the end till we decide who's deliberating. But so we could just have a dismissed juror. It could be an instruction, which would probably be most helpful to all of our dying anxiety and curiosity right now. Is it could be some sort of instruction is given. It's, listen, just a reminder, don't read newspapers. Just a reminder, there's a lot of information on the internet, something along those lines. But could it be the setup for a mistrial? Sure. This is how they begin. This is something happens. Something can't be undone. Some bell can't be unrung. It cannot be cured by dismissing a juror. So yeah, hope that answered your question. It could be anything, says Ritter. But the other reason I wanted to jump on here, and I see that Darlene63 is a new member right on cue, is that we now have membership here on this channel. And I see a lot of green names popping up. So thank you, everybody who decided to go ahead and take part in that early in this whole program. It was something I was going to announce this evening on the main channel or on our Wednesday Night Live, but we decided, why make everybody wait? And let's go ahead and get it going this morning. So thank you all for being a part of that. It's just, a smaller program that we just wanted to be able to offer you guys the ability to, be a member, contribute to the channel, the emojis and all the good stuff that comes along with that. And we'll put up members only polls and try to figure out some other little fun additions along the way. But mainly we appreciate you guys just being a part of the community and helping this channel grow. I tell you, this channel, we didn't know what to expect from it. This live trials channel, we thought it was mainly, the idea was like, hey, you know what? There's a lot of places out there people can go to watch, but maybe not a place where they feel like they can be amongst their friends and have an actual chat about this thing and be able to watch it, not get, on some channel where there's thousands of people commenting at once and you get lost in the whole thing. I wanted to do commentary, but have it be very minimal. I don't want to interrupt the whole thing. To me, it's like watching a movie and having somebody constantly comment and ask questions throughout the movie, and you're constantly pausing and going forward. I know a lot of people enjoy that. I'm not criticizing that at all, but I thought, you know what, some people might enjoy just being able to watch it and then discuss it afterwards or discuss it in the chat. And so we wanted to be able to provide you with kind of an uninterrupted stream. And we hope that that's something that you're enjoying and something that you like. I also wanted to thank everybody who's been so generous this morning, to Kathy and Best Nancy and Alicia K. Mayo and Hazel and Sneemac and P. Lola's mom for the super chat, but for all of you for gifting memberships, that's fantastic. I love that this new membership program is just off to a running start. And to Jenny G for also gifting a membership. So thank you guys so much. I want to tell you one quick thing about some stuff we have coming up on the main channel, and then just kind of pose a question to you that I've been thinking a lot about this trial in particular. And I don't necessarily have an answer to it, but maybe we can just kind of work it out in our heads together. But first of all, tonight is Wednesday Night Live on the main channel, and I hope everybody shows up for that. Highly appreciate you all being there. Darlene63, you're fantastic. Thank you so much for that generous gift of memberships to everybody. Boy, we're just growing. I love it. So we're going to be talking about, amongst other things, but we're going to be talking about the Sean Diddy Combs case, because while this nuttiness is going on in Boston, not too far away in Manhattan is the federal sex trafficking and RICO case of Sean Diddy Combs, which is a hugely important and high profile case. I mean, you're talking about one of the wealthiest music moguls on earth, who's just been a part of the music scene for decades, who may be going to prison for the rest of his life, and going to prison for the rest of his life for some very, very depraved stuff. So that's a case that's far more difficult to follow because there's no cameras in courtroom. So all of it is coming from reporting. So we decided to grab ourselves somebody who's been following it very closely, and that is Julie Janae from Court TV. She's fantastic. I've interviewed her a few times before. We were trying to think of somebody who's been following the case that would be good to come on and just kind of, how we do Wednesday Night Live. It's sort of shoot from the hip stuff. I'm going to throw a bunch of questions at you. We're going to get some questions from viewers and just have a good, fun conversation. We thought that she would be fantastic for us. So that's who's going to be on tonight. And the other thing I wanted to ask you, hold on, is, we always do a poll on Wednesday nights, and what are some cases? I can't guarantee they'll be part of the poll because we kind of have our poll set up in our head. But while we're talking to Julia about Diddy, we always like to run a poll, and I'm curious what other cases are going on that you guys have questions about. Is there a new case that you want to know about? Let us know in the comments, and if a lot of it comes down to, do I know enough about it, or do I have something interesting about it to talk about? But we appreciate the suggestions, and if they change our minds, we will absolutely add them to the poll, and maybe the ones that you're suggesting are going to be part of the poll anyway. So, and one thing I should point out for everybody watching on this channel, you might be new to the Courtroom Confidential community through this channel, and I hope you know about the main channel. I kind of just assume everybody is here because they know about the main channel, but if you don't, come to our main channel, Courtroom Confidential, become a member over there if you can, and follow all the programming that we work very, very hard to pump out for you every single week, which includes, like I said, this evening is Wednesday Night Live. Julia Janae from Court TV will be on to chat with us quite a bit. I'll try to see if she'll stick around for maybe some of the poll questions as well. But I love her. I think she's really smart and really balanced, and she's one of the people on Court TV I really enjoy watching. Then, of course, we have our weekly roundup on Saturday. We have our Sunday fun day. Again, send us those questions. We'll still take questions all the way up until, I think our cutoff now is Friday at midnight on the West Coast. But send them to us. A ton of really great questions that we've already received, but we'll take more. Always love hearing from you guys. Always love the very clever things that you come up with that I never would have thought of. And sometimes it's cases I've never heard of, but sometimes it's questions about cases we've talked about a ton, but looking at them in a fresh new way that I've never thought of. So I'm very appreciative of that. So send us those questions. Go to thecourtroomconfidential.com and send us questions. And then finally, I want to tell you who I interviewed this week, and we're packaging that up and getting it all edited and put together nice. And Kaylin is doing her research and finding old photos of this person. Is the Sarge, Joe Giacalone, is gonna has already sat down with us. We've already interviewed him, and we're going to be putting that episode of our conversation series out on next Monday. So it'll premiere at the same time, 5 p.m. Pacific, 8 p.m. Eastern, that we always do our Monday premieres. And Joe has got a fascinating background. I mean, if you cannot tell from just hearing the guy talk, but we really went in depth into, his decision to become a police officer, how that all came about. Really, I don't want to steal the thunder of it, but it's not what you expect. Like, I expected this was like, I was born and I had a badge and a gun on my hip and I knew what I wanted to do. It's not really that at all. And so he's got this really kind of interesting story and journey through the police department. And then we talk about how did he leave the department? what did he do after, books that he's written, the YouTube channel. Fascinating guy, just another fascinating guy. So please check that out. That's coming up next Monday. All right, I'm going to kind of pose to you my thought experiment I've been going through, and then I'll let you guys go before the court hops back on and give me enough time to hopefully help with the little critters and get them ready for school this morning. But this case is very interesting to me in that, well, for several reasons, but one of them that I'm thinking about this morning is you could look at this from a very scientific perspective, right? And you could say you're going to try to decide this based entirely almost on the expert testimony. There's going to be experts to talk to you about car data, opposing experts, and let them battle it out. There's going to be experts to talk about the cell phone data. What does that say? Location. I mean, remember that fascinating kind of discussion about location data? Where was his phone? Where could it have gone? On cross-examination, he had to admit that, yes, that does include parts of the home. Dog bite evidence. We're going to hear experts. They haven't come yet, but we're going to hear experts about the injuries on John's arm. Are those dog bites? Some are going to say yes. Are they not? I imagine another witness is going to say absolutely not. You know, a lot of, DNA evidence, alcohol content, and evidence about the body's ability to metabolize alcohol, all of this scientific stuff. And you could really grind this out in your head and decide whether or not you feel that there's been a proof beyond a reasonable doubt as to her guilt or innocence or involvement in John's death, just based on all of that. And then kind of as this almost, the way it's been coming out, it's almost like a sideshow. And I don't mean that to minimize it, and I don't mean it to ridicule it, because I think it's incredibly powerful evidence, is all of the statements made by Karen Reed to prior media. And I've never seen this done before, by the way. And I am very hesitant whenever I use that term, never seen this done before. This has never happened before. I don't want to be one of those people that makes you feel like everything you see is for the first time. But I really never have seen this done before, where usually, just so you understand, usually the way this would work in my world, in the way I've seen it done, is that if you're going to present this prior testimony, you call some custodian of records to the stand. And that person, what do you do for a living? I compile and maintain all of the videotape evidence from ID discovery, and I maintained all of the documentary footage that was compiled in this case. Great. I'm going to show to you some clips and tell me if those are part of the things that you've compiled. And that's kind of the dry way that you do it. But the way that the judge is allowing it here and the way that Brennan is doing it, and quite frankly, I don't really know if it's all that wrong. It's just different, is that he's just been sprinkling it throughout. Call a witness, play a video. Call a witness, play a video. Sometimes those videos are in relation to that witness. Sometimes they're, you can tell that sometimes he's trying to establish themes, or comment on what current witnesses have just testified to. But it's a lot of clips from Karen Reed, way more than I thought he was going to use, quite frankly. And to varying degrees of, I would say, impactfulness. Some of them are damaging. I don't care where you fall on Karen Reed. You have to admit that some of the things she has said are awful sounding. And this is my long-winded way of getting to my point here. I wonder what of all of that is most impactful to witnesses. Because if they are, let's say they are buying, the jurors I'm talking about, let's say they are really sold on the defense scientific theory of this case. Let's say they find their witnesses to be more convincing. Let's say they find their cross-examination to be more impactful. Let's say they really are invested in the defense theory of, the timing of certain events, making it nearly impossible for Karen Reed to be involved or whatever, what have you, right? What do they do about those statements? Because to me, you can call all sorts of experts to say, you know, GSR was not existent on the defendant's hand, and the trajectory of the bullet could not have been held by a defendant with the same height, and all of this kind of scientific stuff. And then if the prosecutor plays a recording of your client saying, "Yeah, I happily shot that guy," like, what do you do? What do you do with all of that, right? So in my view, I have always said, and I don't want to go as far as saying what I think Karen Reed has said are admissions. I would not go that far. But I will say that in my experience, the most powerful evidence that can be presented by a prosecutor is evidence of words coming out of the defendant's own mouth, whatever form that takes, whether that is the defendant testifying on the stand, whether that is recorded interviews of the defendant done at the police station, or whether that is surreptitiously recorded conversations that the defendant is having. And in this case, whether that's statements that the defendant made to different media outlets, whatever that is, there is something psychologically very impactful to jurors to hear the defendant themselves speak. And I think it's just part of our natural inclination to be like, you're accusing someone of a crime. Well, what do they say about it? Right? I mean, that's our first instinct in our normal lives. I'm thinking about my little ones. The 2-year-old accuses the 4-year-old of hitting her. First thing I'm going to do is go to the 4-year-old and say, what do you have to say for yourself? Right? 4-year-old doesn't get to say I maintain the fifth, and I assume that means I can't make any assumptions about that. Our natural inclination is to go, what does the accused have to say about all of this? And we go on and on in courts saying they don't have to take the stand, they don't have the burden, but it's really hard to get jurors to wrap their heads around that thing. So now you've got a situation where the defendant is essentially telling them things, but it's very hand-selected items, and it's things said to the media. And again, this is just kind of my long-winded way of saying what is more impactful. As much ground as I feel like the defense may be making with some of these witnesses, and believe me, in all fairness, I think have been tremendously impactful in some of their cross-examination. I mean, we saw Alan perform some cross-examinations on, Jen McCabe and other witnesses, Buchanan, that I thought was at points masterful, at points not doing much, quite honestly, but at points masterful, both of them. I've also seen Hank Brennan do some redirect and rehabilitation of witnesses that I thought was just, about as good as you're going to see in court. This is putting aside however you guys feel about anything. And I got to stop a moment because Cheryl, you're fantastic. Thank you so much for contributing those memberships. And then Suzanne, you're amazing as well. Thank you so much for you guys for helping this new little project of ours grow so quickly. Welcome to the live trials crew. But as good as they may be, and as much ground as they may have gained, and as much doubt as they may have sown in the jurors' minds, is that all undone by what Karen Reed has already said? And by the way, remarkably continues to say outside of court. Like, that's the part that really is galling to me too, is that there's no stopping her. I mean, she goes outside of court and makes comments to the media too. Now, you could say in for a penny, in for a pound, and she's just, she's the only one who's allowed to speak, so she's going to go ahead and speak. And by the way, I don't want it to appear that I am chiding defendants who want to speak to the media. I actually am more in the favor of that than most defense attorneys might be, because I do feel especially in these high profile cases, the defendants find themselves behind the 8 ball. And you've got all of this stuff that's been said by the prosecution and all of this media coverage. And then what they're supposed to just stand there and keep their mouth shut until the justice plays itself out in court. So if there are defendants who in certain situations, and this might be one of them, want to come forward and say, hey, I got something to say about this. I didn't do this thing. And I want people to know that. I'm in favor of that. But I also know that along with that comes a lot of dangers. You are swimming with sharks for sure. And she gave a lot of interviews. We're not talking about a few choice prepared statements. We're talking about sit down interviews, kind of, in my view, appearing to have no parameters, and including a documentary, which it also appears to have given them unfettered behind the scenes access as to everything that was going on. That is remarkable to me, and it looks like it could be causing some damage. And so I guess the thought experiment that I'm playing out in my head is, which do you think is going to be more impactful to jurors? I know how I feel, but I'm curious to how you guys feel. What is more impactful? If the scientific evidence you feel, and I'm not saying it does or doesn't, but even if you feel that the scientific evidence leans in favor of the defense and they have weaved a solid case for reasonable doubt through the scientific evidence, are jurors then just supposed to ignore the words coming out of her mouth and go, well, I know what she's saying, but at the same time, science tells me otherwise? I don't know. It's just it's like I said, an interesting question for all of you. So thank you guys for being here. Sorry that we're staring at a fan this whole time. Chat amongst yourselves. I'll try to pop in later in the day if I can. A lot of stuff we're working on, mainly preparing for the Wednesday night live this evening. Hope to see you all there. That's at 5 p.m. Pacific, 8 p.m. Eastern. Please, everybody show up. Tell your friends. Thank you so much for the support on this channel. Thank you for letting me bug you for a little bit. And I will see you guys all soon. Take care, everybody.
Pleaded.
Please be seated.
All right, so jurors, I still have a couple of questions for you. Were you able to follow the instructions and refrain from doing any independent research or investigation into this case? And we've discussed the other two questions, but I do need to stress for you that it's very, very important that no one discuss this case. Don't let anyone talk to you about the case, no comments about the case. You've seen how hard the lawyers have worked to pull this case together for you, and everybody's given it so much time. So please, let's make sure that we follow that. That means each other. So with that, I know we're late getting started. We're going to take an abbreviated lunch today, only 30 minutes, and abbreviated breaks. So no morning break. We're going to start now and go till 1. All right, Mr. Brennan, and we're taking a witness out of order. I apologize. We've got a witness here. Sometimes we take witnesses out of order. Ms. Hanley will be back later for the rest of her testimony, but we've got a witness here that we'll call out of order. Thank you. Mr. Brennan, thanks.
Thank you, Your Honor. The Commonwealth calls Dr. Wolf.
Raise your right hand, please.
You solemnly swear the evidence you give to the court and jury in the case now and hearing to the truth, the whole truth, and nothing but the truth, so help you God. I do. Thank you.
Good morning, doctor.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Isaac, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors and trigeminal neuralgia. But I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work, 5 days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much percent of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
I want you to take us through some of your education and background. Could you share with us where you went to medical school and where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately at the university hospital for elective cases. We also do 6 months of pediatric neurosurgical residency.
Did you do a fellowship at New York University?
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions, and so that you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a year, a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently the director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
Do you conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, and then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes.
Are you a member, a fellow American of the College of Surgeons?
Yes.
Are you a member of North American Skull-Based Society?
Yes,
And is that brain related?
it is.
Are you a member of the Society for Neuro-Oncology?
Yes.
Are you a member of over, or at least 34 different professional memberships?
Yes.
In your career, have you engaged in research?
Yes.
Has that research focused or centered on brain injury?
Yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head injured patients?
Yes.
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
It actually was in the treatment of severe head injuries, patients who are unconscious, the concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG, SOD, and severe head injury?
Yes.
Could you describe that very briefly?
Basically the same, one of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after a brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you author of a book chapter, imaging of craniocerebral trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter, intracranial injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question without a comment, please.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic Ischemia and Hypoxic Cerebral Insults?
Yes.
Were you the author of a journal article, Post-Traumatic Cerebral Infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base. Prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain x-rays. The idea was to see if we could identify them more clearly. And so we classified them and delineate them in the paper and discuss the outcomes that were relative to those type of injuries.
In the last journal article I'll ask you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Do you lecture?
Yes.
Do you have peer-reviewed publications?
Yes. That was one of them.
Thank you. And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career and your study and your clinical experience, have you treated different types of brain injuries.
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy. And I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes. And so, doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside the skull of Mr. John O'Keefe?
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum that connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards, and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It gets, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward because you have cerebrospinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs in trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning. You said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes. I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold, hard ground?
Objection, Your Honor. Can we have sidebar on that, please?
So I'm sustaining the objection, so no sidebar.
Your Honor.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Objection, Your Honor. Again, request kindly a sidebar on this.
All right, we'll come to
Thank you.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen, in your experience, similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the, forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota.
you-
It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup counter coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped. And it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
It's, this is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture. Blunt trauma, the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking me, does the rest, I mean, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roots lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No, the brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
In your study of the records and photographs and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial. And it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function. And that's why I was talking about, that there's a variation on the theme from a simple concussion to a severe concussion like this.
If a person does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Yes, this is the interesting thing about our brain. So the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious, as an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you share?
I don't.
I'm sorry.
Yes, I'll tell you. There is very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop. Decreased blood flow to your brain because you're getting swelling. And ultimately, death of the brainstem that controls your heart and your breathing. And so this is why there is a whole big issue about brain death. You know, when is someone brain dead? Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures, if he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
You take that down, please. If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. One, you want to have enough oxygen going to the brain to feed it. And 2, you want to keep your carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case by case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of their brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well, hypothermia, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I've asked you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Dr. Wolf, thank you.
All right.
Let me have a moment, Your Honor.
Sure.
Thank you.
May I, Your Honor?
Yes.
Morning, Doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make cappuccino for my wife at 6 o'clock in the morning. And then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I mean, I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist in.
I am, if you could have asked that question, very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Right. And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And is it correct to say that the brains that you see are of living people?
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last word.
I'm sorry, with the topic is going to be Mr. O'Keefe, the decedent in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolk,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Okay, go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
I have one more moment, Your Honor. Thank you.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Any brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set, so we can get you out of here.
Thank you very much.
All right. Mr. Brennan?
May we have a moment to inquire of our next witness?
Sure. And while I see counsel inside our jurors, feel free to stand up and stretch. So, jurors, you may realize that that went quicker than we thought. So we are ahead of schedule. So why don't we take that morning break that we can take? So we'll take a 15 or 20-minute break.
All rise for the court, please. Jurors, close your Back in session, you may be seated.
All right, may we have Ms. Hanley, please?
And ma'am, I'll remind you, you're still under oath and to keep your voice up.
Good afternoon. All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor. And ma'am, if you could just please introduce yourself to the jury again, spelling your last name for the record.
Sure. I'm Christina Hanley. Hanley is spelled Hanley.
And Ms. Hanley, given the break, if I could just ask you a few questions, just to reorient as far as the items that we were speaking about yesterday in your testimony. First, starting with the items of glass that you analyzed in this case. The first of those items was an item 3-2, is that correct?
That's correct.
And if you could, please describe for the jury, or please provide the jury with the description for that item that you received.
Sure. So item 3-2 was a clear glass cup with broken irregular edges. And there was some dirt debris material that was noted on the exterior and interior surfaces.
Your Honor, may I approach?
Yes. Did you show counsel? All right.
I gave Mr. Jackson my copy, yes, thank you. Showing you a photograph, Ms. Hanley, do you recognize that?
Yes, I do.
And what do you recognize that?
So this is a photograph that I took. It's item 3-2, but it's also, I would have to double check on my notes, but I believe it has item 7-12, one of the pieces that I'm holding that's showing a physical match between those two items.
Your Honor, call both seats to introduce in the minutes of the next exhibit.
No objection.
Okay.
Exhibit 195.
And Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9490. Ms. Hanley, what's up on the screen? Is that the photograph that I just presented to you?
Yes, it is.
And if you could, please describe for the jury what we're looking at here.
So that is a photograph that I took upon examination. It is the clear glass cup item 3-2. And I'm holding another piece, which again, I believe it's one of the pieces from item 7-12. I would need to confirm in my file, but I'm showing that one of the pieces physically fits with item 3-2.
Thank you, ma'am. Ms. Gilman, you can take that down. May I approach again, Your Honor?
Yes.
Showing you two other photographs. If you can look at those, look up when you're finished. Did you recognize those?
Yes, I do.
And what do you recognize those as?
So these are photographs that I took of item 7-12.
Your Honor, call both seats to introduce in the minutes the next exhibit A and B.
Is there any objection?
No objection.
Thank you.
Exhibits 196A and 196B.
And Ms. Hanley, if you could, just remind the jury as far as the physical description that you received in regard to item 7-12.
Sure. So item 7-12 consisted of some clear plastic pieces as well as 9 pieces of glass with broken irregular edges.
And may I publish, Your Honor?
Yes.
And Ms. Gilman, if I could have first photograph 9476. And if you can enlarge that just a bit, Ms. Gilman. And Ms. Hanley, what are we looking at in this photograph?
So this is the photo that I took of item 7-12 as I received it. So there's the several pieces of clear glass with broken irregular edges.
And Ms. Gilman, if I could have 9477. And if you can enlarge that just a bit. And again, Ms. Hanley, what are we looking at in this photograph?
Those are the same pieces of glass as in the previous photo, just a little bit more up close of the clear glass that was recovered and is item 7-12.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, as far as a comparative analysis between items in 3-2, the glass cup, and 7-12 regarding the glass pieces, what, if any, conclusions did you make in reference to your comparison between those two items?
Sure. So upon comparing those items, I did note that 6 of the 9 pieces of clear apparent glass had a physical match to item 3-2, the clear glass cup.
And if you could just remind the jury, as far as a physical match, what does that mean?
So a physical match is basically if an item breaks and those items have broken irregular edges, if those pieces come back together like a jigsaw fit, then it's a physical match and they were at one time together as one larger unit.
Now, as far as each of those items within 7-12 had a letter associated with them, correct?
Yes.
And do you recall which of the 6 were a physical match for item 3-2, the glass?
I would just need to refer to my notes for the exact letters.
Sure, you can take your report out.
The 6 pieces of glass from item 7-12 that physically fit to item 3-2 were A, B, C, D, F, and K.
May I approach, Your Honor?
Yes.
Well, let me ask you this first. I'm sorry. So, Ms. Hanley, during the course of this physical match analysis that you're conducting, are you memorializing that process with photographs as well?
Yes, I am.
May I approach, Your Honor?
Yes.
I'm presenting you with 4 photographs. If you could review those and look up when you finish. And do you recognize those, ma'am?
Yes, I do.
And what do you recognize those?
Those are photographs that I took upon my examination of items 7-12 and item 3-2.
Your Honor, the combo seeks to introduce and admit as the next exhibits A through D.
No objection.
Thank you.
Exhibits 197A through D.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9502, please. And Ms. Hanley, what's up on the screen? Can you please describe for the jury what we're looking at in this photograph?
So this is one of the photos that I took of one of the breaks that physically fit together between item 3-2 and item 7-12.
And Ms. Gilman, if I could have 9514. And again, Ms. Hanley, can you please describe for the jury what we're looking at in this photograph?
Sure. So this is a photo that I took when I was doing my comparison of item 3-2 and several pieces from item 7-12.
Now, as far as the individual pieces had sort of little white stickers or labels affixed to them, is that correct?
Yes.
Is that something that you did, or is that something that when the items were provided to you was already done?
So item 7-12, I received those pieces with the labels already on them.
And again, those items, especially 7-12, had been with mixed veneer in your unit prior to coming to your table or your station, correct?
Yes.
Ms. Gilman, if I could have 9518. Again, Ms. Hanley, what are we looking at here?
So this is another photograph that I took of the physical match. It's just another view of the items together of item 3-2 and several pieces from item 7-12.
And lastly, for this batch, Ms. Gilman, if I could have 9520. And again, Ms. Hanley, what are we looking at here?
So this is another picture that I took of the items just slightly rotated of item 3-2 with a physical fit to several items or several pieces from item 7-12.
Ms. Hanley, is there a laser pointer on the desk in front of you?
Yes.
If you could, preferably using this screen just so it's visible for the jury, could you delineate where you see in this photograph item 3-2 and where you see the items associated with item 7-12?
So this right here is item 3-2, and these pieces up here are several pieces from 7-12.
Thank you. Ms. Gilman, you can take that down. Now, the other two items that you analyzed or examined in this part of your physical match analysis were items 3-3 and 7-14, correct?
That's correct.
And turning your attention specifically to item 3-3, if you could just remind the jury as far as the physical description of that item that was provided to you.
Sure. So item 3-3 was 5 pieces of clear glass with broken irregular edges that were recovered from the bumper of the vehicle.
May I approach again, Your Honor?
Yes.
Single photograph, do you recognize that?
Yes, I do.
And what do you recognize that?
That is a photo that I took of item 3-3.
Your Honor, Commonwealth seek to introduce in the minutes the next exhibit.
No objection, Mr. Jackson?
No objection, Your Honor.
Exhibit 198.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9446, please. And Ms. Hanley, in addition to the 5 pieces of glass associated with item 3-3, what else is depicted in this photograph?
This is a photo of the 5 total pieces that are from item 3-3.
And in addition to that, is there a ruler depicted in this photograph as well?
Yes, there is.
And what is the purpose of that ruler in the photograph?
It's there just as a scale.
Thank you, Ms. Gilman. You can take that one down. And Ms. Hanley, the last of those items, 7-14, if you could just remind the jury as far as what was the physical description that was provided to you in reference to item 7-14.
Sure. So item 7-14 was a clear piece of glass with broken irregular edges that was recovered from the road.
May I approach again, Your Honor?
Yes.
Again, Ms. Hanley, just showing you a single photograph. Do you recognize that?
Yes, I do.
And what do you recognize?
This is a photo that I took of item 7-14.
Your Honor, I'll seek to introduce the next exhibit.
No objection.
All right.
Exhibit 199.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9471, please.
So
And again-
the two screens don't match. Thank you.
Thank you, Your Honor. Ms. Hanley, again, if you could just describe for the jury what is depicted in the photograph up on the screen.
This is the photo that I took of item 7-14.
Thank you. Ms. Gilman, you can take that down. So, Ms. Hanley, in addition to the physical match analysis that you did between item 3-2, the cup, and 6 of the pieces that you found to be a physical match from item 7-12, did you also compare pieces from item 3-2, 7-12, and 7-14?
Yes, I did.
And what did you conclude in your physical match analysis of those items together?
So upon examining and comparing item 3-2, 7-12, and 7-14, I had concluded that 6 of the 9 pieces of glass from 7-12 physically fit with item 3-2, and the remaining 3 of the 9 from 7-12 did not have a physical fit to item 3-2. I also compared item 3-2 and 7-12 to 7-14, but there was no physical match to item 7-14.
Now, in addition to that, did you also do a physical match analysis between item 3-2, the drinking glass, 7-12, pieces found from the roadway, and certain pieces from 3-3 from the bumper of the vehicle?
Yes, I did.
And what did you conclude based on that physical match analysis between those items?
So upon examining and comparing those items, so there were 5 total pieces of glass from item 3-3. I used 2 of those pieces for physical match comparison to the items recovered from the road. Upon my examination, I did not, there was no physical match between those 2 pieces from item 3-3 to any of the pieces recovered from the road. So that included items 3-2, 7-12, and 7-14.
Now, as far as the 2 pieces that you had selected from item 3-3, do you recall which of those 2 lettered pieces you chose for your comparative analysis?
Yes.
And which were they?
They were pieces A and B.
And if I could ask why pieces A and B versus other pieces?
So A and B were used for physical match. The remaining 3 of the 5 were not used for physical match comparison due to their size and condition.
Now, those same 2 pieces from item 3-3, pieces A and B, did you then do a physical match analysis between that and 7-14?
I did.
And what did you conclude from that analysis?
I concluded that there was no physical match between the two pieces from item 3-3 to item 7-14.
Now, did you also do a physical match analysis between piece E from item 3-3 from the bumper?
I did not. No, not a physical match examination.
Did you do any comparative analysis between a piece of glass E from 3-3 from the bumper and item 7-14?
Yes, I did.
And what did you conclude from that analysis?
So I selected piece E for further examination. I did microscopic examination as well as instrumental analysis, and I did the same microscopic and instrumental analysis to 7-14, and I compared the data, and I came to the conclusion that the piece that I sampled from item 3-3, piece E, was found to be consistent in physical and instrumental properties to the sample that I took from item 7-14.
If you could, Ms. Hanley, could you please explain to the jury when you say instrumental analysis, what is that? What does that consist of?
So the instrumental analysis that I conducted was on the GRIM instrument, which measures the refractive index of the samples. So after I had ran my samples for both item 3-3 and 7-14, I compared the data to determine whether they were consistent or not consistent.
And so when you say that something is consistent in instrumental properties, what does that mean?
So in this instance, they had consistent refractive indices.
In addition to that comparative analysis for the glass items, what other additional examinations did you perform in this case?
Sorry, could you say that again?
In addition to items 3-2, 3-3, 7-12, and 7-14, what other items did you look at in this case?
So I also examined item 3-1 and item 7-18.18.
And what was the description provided to you in reference to item 3-1?
3-1 was a taillight, and there were also some other plastic pieces as well.
And taillight from the same vehicle as the glass from the bumper, correct?
Yes.
May I approach, Your Honor?
Yes.
You have another single photograph. Do you recognize that?
Yes, I do.
And what do you recognize that?
This is the photo that I took of item 3-1.
Your Honor, the Commonwealth will seek to introduce in a minute.
No objection.
Thank you.
200.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have photograph 9394. And Ms. Hanley, do you recognize what's up on the screen as Exhibit 200?
Yes, I do.
And what do you recognize it to be?
This is the photo that I took of item 3-1.
And what's contained in here, is that a fair and accurate portrayal of what the item 3-1, the taillight housing, looked like when you received it?
Yes.
Now, as far as, and we'll get to this more a bit in a moment, but as far as any sort of comparative analysis that you did with any other item, what part of this taillight housing were you comparing to that other item?
So there were clear and red plastic portions of the taillight that appeared to be broken. So I sampled portions of the clear plastic as well as the red plastic on the taillight.
And just for clarity purposes, if you could with the pointer, as far as which of these pieces up on the screen were you sampling the clear and or the red plastic from?
So the red plastic that I sampled was from this area. It's a little hard to tell from here. I think I'd have to refer to my photo in my notes, but I think there were a couple of different areas that had clear broken plastic. I think this might have been one of the areas that was broken that I sampled.
And just for my purposes, really what I'm asking, Ms. Hanley, is the clear plastic that you used from item 3-1 was from the housing unit itself, the large piece, correct?
Yes.
Okay. Ms. Gilman, you can take that down. Now, the other item that you were comparing this to was item 7-18.18. Is that correct?
Yes, that's correct.
And what was provided to you as the description of that item, 7-18.18?
7-18.18 was debris that was collected from 2 pieces of clothing from the victim.
And specifically, that would be 7-17, an orange t-shirt. Is that correct?
I believe that is correct, yeah.
Okay, as well as 7-18, a gray long sleeve shirt. Is that correct?
Yes.
And when you say that item 7-18.18 contained debris, what did that debris consist of?
So the debris consisted of one clear piece of plastic, as well as several pieces of red plastic, among some other trace material.
Now, were there measurements taken of those items within the debris, specifically the clear plastic and the red plastic?
Yes.
And what were those measured to be?
I would just need to refer to my report for that.
Okay, go ahead.
Thank you. Okay, so the clear piece of plastic in 7-18.18, it measured approximately 1/8 of an inch by 1/16 of an inch. And then I measured the largest and the smallest of the red plastic pieces. And the largest piece of red plastic measured approximately 1/16 of an inch by less than 1/16 of an inch. And the smallest piece among those measured approximately less than 1/16 of an inch by less than 1/16 of an inch.
And so those particular pieces that you measured, about how small are we talking about?
So the largest for the red plastic, the largest piece measured, just for visual purposes, it's roughly like the size of a grain of rice. The rest of the pieces were smaller than that.
And who within the lab provided that debris in that taillight housing to your unit, to the trace unit?
So the debris from the clothing was transferred to my unit by Maureen Hartnett, and the taillight was submitted to the lab by Trooper Christopher Moore.
May I approach, Your Honor?
Yes.
series of 5 photographs. You could review those and look up when you're finished. Generally speaking, Ms. Hanley, do you recognize what's depicted in those photographs?
Yes, I do.
And what do you recognize those?
Those are the photographs that I took of 7-18.18.
I'm going to come both to seek, introduce, and admit as the next exhibit, A through E.
No objection.
Thank you. It's 201 A through E.
Your Honor, may I publish?
Yes.
Now, Ms. Gilman, if I could have photograph 9352. And Ms. Hanley, what is depicted in this photograph on the screen?
So this is one of the photos that I took of 7-18.18. This is how I received the clear piece of plastic.
And is that a tin that it's encased in at the time that you receive it?
Yes.
Ms. Gilman, if I could have 9355. And what is this, Ms. Hanley?
So this is a photo of the clear piece of plastic that was within that tin.
Ms. Gilman, if I could have 9364. And Ms. Gilman, if you could enlarge this just a bit. Maybe just a little more, please. Thank you. And Ms. Hanley, what are we looking at in this photograph?
This is the photo that I took of the debris that was collected from the clothing items.
Ms. Gilman, if I could have 9366. And again, Ms. Hanley, what are we looking at here?
This is a photo that I took under a microscope of the red plastic pieces that I noted within the debris.
And lastly, Ms. Gilman, if we could have photograph 9369. And Ms. Hanley, what are we looking at here?
This is a picture that I took of the red plastic pieces that I removed from the debris.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, in reference to your comparative analysis from item 3-1, the taillight housing plastic, to the clear and red plastic pieces of debris from plastic debris from item 7-18.18, the clothing of Mr. O'Keefe, what types of instruments did you utilize in this comparative analysis?
Sure. So after completing my examination, I utilized a comparison microscope as well as a polarized microscope, a FTIR, which is Fourier transform infrared spectrometer. And I also used a microspectrophotometer, also known as a microspec.
And what is a microspec?
So a microspec is an analytical tool that we can use to examine samples that have color. So it provides information on the sample's dyes and pigments.
And how is that utilized in your comparative analysis?
So I ran samples from both items that I was comparing, and I compared the data from those two items as a part of my comparative analysis.
And when you run that sort of data, can you describe for the jury sort of what that data looks like? Like what are you physically seeing when you're examining the data from a microspec?
So What we refer to it as a spectrum or just a graph. And when we do the comparison, we can overlay those spectra or graph to determine if they are consistent or not consistent.
And I know you spoke a little bit about it in your testimony yesterday, but if you could remind the jury as far as an FTIR, what is that and how is that used in your analysis?
So an FTIR is another analytical tool that we can use. A sample is exposed to infrared light and it reacts in a certain way with that light. And what's produced is a spectrum of peaks and valleys that are representative and unique to your sample. And so that instrument was used to run samples from both items, and then the data was compared from both items.
Now, from your comparison of starting with the clear plastic from the debris from Mr. O'Keefe's clothing, from your comparative analysis of that clear plastic to the clear plastic from item 3-1, the tail light, what did you conclude?
So the clear plastic from the debris was found to be consistent in color and instrumental properties to the clear plastic from the taillight. So accordingly, the clear plastic from the debris could have originated from the clear plastic from the taillight or from another source with the same characteristics.
And with reference to the red plastic from item 7-18.18 from Mr. O'Keefe's clothing, in your comparison of that red plastic with the red plastic from the passenger side taillight of the defendant's vehicle, item 3-1, what did you conclude from that analysis?
So the red plastic that I sampled from item from the debris from the clothing from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the portions that I sampled from the red plastic from the taillight. So accordingly, the red plastic from item 7-18.18 could have originated from the red plastic that I sampled from the taillight or from another source with the same characteristics.
I'm sorry, Your Honor, if I could just hold on 1 minute while the sirens pass. May I approach again, Your Honor?
Yes. Actually, is this a good time to take a break, Mr. Lally?
Entirely up to the court. I probably have another 3-4 minutes left.
I'm going to see counsel for 2 minutes, folks. Like I told you earlier, we're ahead of schedule, so we will take a luncheon break, and we'll take an hour. So I know we'll take an hour. Okay, we'll see you back here. So we'll just go and follow.
All rise for the court, please. Jurors, close your notebooks, follow me.
Hello and welcome back for another installment in our Courtroom Confidential Conversation series. For this episode, please join me in welcoming Paul from Reporting Live from My Sofa. Hello, Paul. How are you, my friend?
Hello, hello. I'm doing good. How are you doing?
I'm doing very well. Thank you so much for taking the time to do this. I think what people need to appreciate too is that I have just met you. We just met a few moments ago before we started to record this. So this is going to be fun for me. A lot of the questions I'm about to ask you, I have no idea what the answers are. So this is fun at getting to know someone. But I have been a fan of yours from your show, Reporting Live from My Sofa. I want to get into where that name came from because I love it. But I guess the first thing, part of the reason we've been doing these conversations is you do have a huge following. You have over 100,000 subscribers now, people who are really enjoy your content, but they might not know a whole bunch about you. And so that's the point of these conversations, is to find out a little bit about the creators in this true crime space. And you are one of them. So let's just jump right in. Tell us a little bit about world before YouTube. Where did you grow up? What is your background?
So and again, I appreciate you having me on. That's really cool and awesome. And I grew up in North Carolina, in a town, well, like the Raleigh-Durham Chapel Hill area, but in like a little town in that area and whatnot, although it's not little anymore. So grew up there, kind of lived around like probably my early 20s and late teens and stuff like that. Ended up back here, I guess at this point, maybe like 10 years ago, and I've kind of just stayed put or whatever. Like I said, I came back to go back to school as an older student, and so I'm very big on education. That definitely changed my life and like gave me direction in many ways and whatnot. And so yeah, I'm just from North Kakalaki. I'm a country boy, kind of, sort of.
I love it.
If you ask real country people, they'd be like, he's not a country boy, but I consider myself that.
I think you have the credentials to back it up. We'll
I
allow
know,
you to
right?
go with it. I was reading over the bio, I think that you either have on your website or your YouTube page, and you talk about going back as a student. And one of the things you say is that you have a degree in English and creative writing. Is that right? Is that what you went back to school for?
Yes.
Tell us about that. What was that, a passion of yours? Is that something you still intend to pursue?
So yeah, that's funny because I started going back to school and it was more like wanting to, I don't even know how you would say it, like broaden my horizons or whatever you would say. So when I went to community college, I really gravitated towards English and stuff like that and whatnot. Now I was more of like a literature kid, if you would, a theater kid in high school and that type of stuff. So I was doing all that and befriended one of my professors, and she kind of took me under her wing, and I got very big into like short stories and, fiction writing, and did really well with that. And ended up getting like a pretty big scholarship and whatnot based on creative writing and whatnot. So that enabled me to kind of pick where I wanted to go for another 2, to finish my 4-year degree. And so that changed a lot of my trajectory. I wasn't really like it literally started off as like, I just want to broaden my horizons and do whatever. So then it was like, oh, okay, well now this is what you're doing. And so that prompted me to come back to North Carolina. I looked up the local schools here and really resonated with North Carolina State University. There were some writers there that I really liked. Belle Boggs, shout out to her, love her. And so really she was a huge draw that made me be like, I want to go there. And so that's what I did. And I guess you could say, like, in my world, I was like, well, you know what? I'm going to kind of go the route of like publishing short stories and some whatever. And obviously that hasn't happened. I mean, kind of, sort of, but not in that fashion, and being a professor and whatnot. And so then I ended up getting more into my true crime obsession. And so at this point, I see how I utilize my degree and all that kind of stuff and whatnot with storytelling and all
Yes.
that. But it's some of those things where, you start off on a certain path, like this is where I'm going to go. And it ends up going a little bit to the left and right and whatnot. And I'm doing the left and right and whatnot with it.
Yeah. No, one of the things that a lot of people I'll see in the comments of your videos, you really enjoy your storytelling. And I think that is such an important part of kind of the true crime community is it's not just reporting, right? Anybody can kind of sit down and tell you the facts of, such and such, wife was killed by husband and buried under the stairs and all of that. But it's the story behind it and what led to all of that really engages people. And I think why people have such a passion for this. Well, we are kindred spirits because I was a creative writing major in college.
Oh, really?
Oh, yeah. And I'm not using it either, but it was kind of a passion of mine. And I think I picked it because it also could have helped me avoid taking certain math classes in college. And I did enjoy that whole world. And there was a period of time where I think I thought, I'm going to become a short story writer or a screenplay writer, but it hasn't worked out. But I think it has translated, like you said, to other passions that I now have in life. So you're at what point though does this crazy idea of, hey, I'm going to get on YouTube and I'm going to start this channel. And when you started it, was it with the intention of talking about true crime?
So, yeah. And on that note, so what happened is, I graduated and, obviously I was like, okay, am I going to go to graduate school? Am I going to do this? Like, what's going to happen? Now, in that interim, I had met my partner and that kind of started changing things a little bit. Cause also remember, like I'm an older student, so I already have like life going on and whatnot. Now the scholarship thing enabled me to live in a bubble for a little bit of time and really pursue that. So long story short, I get done with school and I'm kind of like, cause one thing, and I don't know if you had this experience with creative writing and whatnot, but by the end of it, I was like, I don't want to write one more thing. You know what I'm saying? I was so tired of research and writing and that kind of thing. So, backdrop to that is, I've always been into true crime, watching documentaries, reading books, that kind of thing. So my partner and I, we would be like sitting on the sofa watching TV, and I was a perpetual person and I still am. Like if we're sitting on the TV watching it, but I'll be like, hand me the remote, and I'll pause it, and then I'll literally be like, okay, well look, this is what's about to happen. So and so is going to do this. It's so obvious that this, whatever. So he would be sitting there, and he'd be like, oh good Lord, here goes Paul reporting live from the damn sofa. Yeah, he's going to solve the world's problems with a bonbon in one hand and a remote in the other. Kind of a thing. And so it was like this joke we had. And so we were kind of figuring out what we were going to do and whatnot. And, I'm just working like these kind of whatever jobs at that point. And I just had this idea where I was like, I wonder, and I knew what YouTube was obviously, but not like I didn't watch true crime on YouTube. I didn't consume that kind of content in that way. But one day we were talking and I was like, I wonder if I made a video about one of these like true crime documentaries that we watched, and I could put it somewhere like as like Facebook or YouTube or something, and like people could respond and see if they talk about it, and that could be my creative outlet. Because at that point I was kind of like, I don't know if I'm going to end up doing this writing thing, and I was like, that could be like my hobby, that could be what I do, for my little outlet or whatever. And then I was like, I can name it Reporting Live from My Sofa, like we do, like whatever. And so we did, and we were in the process of moving and all this stuff. So we started off, and people who've like followed me for the very beginning, we had sold our townhome and we're doing camper life, and we were going to like travel around and be camp host at campgrounds and all this. So he would get his phone, and I would sit on like the camper sofa with the dogs, and he'd record it, and I would just be like, okay, yeah, so I watched this, whatever, and what, like, I didn't know how to edit, like I didn't know any of that stuff, but it was a hobby, you know what I'm saying? So
Right.
I had no intentions of this right here at all. And
Did you even know at that point what the kind of true crime space was like on YouTube or any of that? No.
No,
You're just
no,
saying,
not at all.
you're just saying, I've got some thoughts. Let's record it and throw it out there and see what happens.
Yeah, it was so weird. I mean, it's so now looking back, I'm like, I don't know how I found my way to that idea. You know, it was just like, you know, it was so weird. And I'm sure, like, I mean, this is a while ago, it's like 6 or 7 years ago. So I'm sure there was like conversations of like, you know, maybe we would try YouTube or whatever. And I think the first video I ever did was Murder Mountain on Netflix, this documentary about this thing in California where they do they grow certain plants and like this whole world up in these mountains or whatever. And and then soon after, this is how out of touch with like the true crime community on YouTube I was at that point. I was like, well, let me see what people are talking about in here after that. And I was like, what's this Chris Watts situation? And like that was coming up, and I was like, I've heard of this, you know, because I was more familiar with older stories and like that kind of thing in the documentaries, and that was just tidying up. And so you already know, like I started watching stuff on that, and it was the end of that case and whatnot. So that's like the timeline of what the temperature was on YouTube when I started just interacting with that space.
At what point, though, it must have reached a little bit of a tipping point, or a point where you started to get some traction and you started to realize, hey, I'm not just doing this as kind of a outlet for me, but people are watching this, and I'm starting to get people who are interested in what I'm saying. And it turns, you know, from kind of a side hobby into, let me put some effort into this.
Yeah, I would say it kind of happened quickly in that realm, I guess. And maybe like, because I think at that time, and I don't know how this still works or whatever, it might be different. But at that time, I think you had to get like 1,000 subscribers and 4,000 watch hours or something like that to get monetized and whatnot. And I felt like again, this is just looking back, I feel like the 1,000 subscribers, like it kind of was like, bam, here you are all of a sudden. You know what I mean? Like you got that 1,000 subscribers, like somewhat, you know, several months, but quickly. And that's where I was like, oh, wow. And discovering the process in that of the comment sections, which, you know, can be good and bad all at the same time. But the conversations that take place there were so interesting. It was very fulfilling in that manner, because that's what I was looking for, is that conversation and that dialogue and talking about these cases, you know. And then again, that's when I started really getting into like the current true crime, because I feel like YouTube is like current true crime stuff or whatever for the most part. I mean, there's something out there for everything, but that's about when that started taking place, and all just started clicking, where I'm like having these great conversations and meeting people, and you know, just starting that interaction and meeting other people who watch, you know, true crime content and can talk about it in that realm.
Many people I've talked to, it's funny to me, they end up on YouTube and they have hundreds of thousands of subscribers, and they never imagine themselves being in front of a camera, or they're even still to this day uncomfortable with it. Was that something that you ever struggled with? The idea that like, oh boy, now I've got, you know, like you said, first it was 1,000 people, now it's 100,000 people. Was that ever something you were uncomfortable with, or is that something that comes naturally to you?
I think I don't know how to say this other than it's not real to me, if that makes sense. Because like I'm sitting here, like this is real. I'm talking to you, you know what I'm saying? But I'm still like in this room right here. But especially when I do my videos, and especially now or whatever, like to me, when I'm talking to the camera, I'm talking to somebody, if that makes sense, but like one person. Like literally, I'll forget sometimes. And when I go back in editing, I'm like, Paul, you literally are just taught like this is, if somebody watched this, they'd be like, what's wrong with him? Because I'm having this full blown conversation with the camera. But like, if you were to put me in front of a room of 100,000 people, yeah, I would probably throw up before I go in on stage, and then I would be fine. Like I said, I did theater and stuff in high school, and I would get so nervous beforehand. But once I walked on stage, it was like so much fun to me. And this is a little bit different than that, because again, it's in the comfort of my home. But like Crime Con, whenever we go there, I mean, I get like deathly like anxiety ridden sick on the way there, like whether it's flying or driving. I'm like, what have I done? I can't believe, oh my gosh, what am I doing? This is you know. And then once
Right.
I'm there and talking to everybody and meeting people, I'm like, oh, okay, cool. So, but yeah, I mean, I never expected to have a following or any of that, but I guess I just don't think of it because it's just me and the camera, and I treat it kind of like a friend because that's just how I view the community. You know what I mean?
You make absolute sense to me because I'm doing the same thing. I'm sitting in a room looking at a computer. It's hard to then realize that is going to have an impact way beyond the walls of this little room that I'm sitting in. But when you go to something like CrimeCon, and I'm glad that you brought that up, it is amazing to see the impact that it has and the community of people who are into this. And I thought it was absolutely wild. I went to my first CrimeCon in 2024, the one that was in Nashville. Were you out there?
Mm-hmm.
Yeah. I was blown away. It was wild. And I was so impressed with the enthusiasm of people and what a wonderful group of people everyone is, and how they just have this kind of positive, enthusiastic attitude about this whole kind of little niche of a world that we've carved out for ourselves. Was it wild to you to then be there and have these folks that you've been speaking to through a computer lens all of a sudden now are in the flesh and you're saying hi to them?
You know, I didn't know what to expect the first CrimeCon that I went to, because I was like, you know, you think of Comic-Con and things like this. I'm like, what is this? But I was like, let's go find out. I was so blown away by the humanity, by the empathy, by the friendships. It gives me goosebumps, makes me want to cry, by the human connection on so many different levels, like from the speakers that we had, you know what I'm saying, that were present and whatnot, standing in line to get a soda or whatever it is, and you just strike up a conversation like you've known somebody forever, you know, on the level of making connection, of finding your tribe kind of a vibe of like, here's people that you could literally be like, you don't even know them, and be like, so what's your theory on the John Bonet case? And you just immediately start talking about whatever, you know what I'm saying? And so I tell people, like, oftentimes, like, you know, in the community and whatnot, when they're talking, they're nervous to go. And I'm like, people don't believe it, but I'm like, I'm super social anxiety, super low self-esteem. If I can go and like, anybody can. And I'm like, you don't need a friend to go. I mean, I get you want to do stuff, you know, with other people, but I'm like, you'll make friends instantly, right? Everyone is so wonderfully nice. I've never seen anything negative there in that context. And then also to get a heartbeat on the people involved in these cases, their stories. You know, one of the things that really pulls me into true crime is the human experience, human resilience, and the ability to go on. And, you know, mostly speaking of the victims surviving, people of like victims and whatnot, and this life that they were thrown into that they didn't ask to be thrown into, obviously, and that ability to overcome, and then all the way going to something like CrimeCon, getting on a stage in front of people, telling their story, and how much that does for other people to witness that and hear that and see that. It's absolutely amazing. And so it was completely not what I was thinking, you know, at all. And now I'm literally like, I mean, I booked my tickets like the next year. I'm like, we're going.
Yeah. No, I called my wife and I'm like, this is mind blowing. I had no idea. I don't know. I think I was in your same spot. I didn't know what I was going to expect entirely. And I was just blown away by the kind of positive vibe, like you said. The energy of the whole place was really incredible. So I highly encourage anybody to go check it out if you're interested in this true crime world that we've all involved ourselves in. One thing that you said that I really want to compliment you and the community that you have built and attracted is how you are very victim oriented and do care a lot about the victims and bringing them the proper amount of respect and everything. So I appreciate that and wanted to compliment you, make sure I complimented you on that.
Thank you.
Do you primarily concentrate on doing recorded videos or live streams or a mix of both? What is the kind of channel you're hoping to grow?
So what I do is pretty much a little bit of both. I have two separate channels. So there's the main channel reporting live from my sofa, and then there's the reporting live from my sofa, the podcast channel. And that's the main one that I go live on and whatnot. Now I'll do like major, what do you say, like events and stuff like that. Like I'll go live on the main channel, but people at this point look to my other channel for lives because that one's more casual. Honestly, it's more messy. You know what I'm saying? Where I'll just be like, we got to talk about this. Like it's not structured and whatnot. And the main channel is more recorded videos, things of that nature. So it's almost kind of like both because I enjoy both platforms. I think they each bring something different to it.
So talk to us a little bit about the recorded videos. What is the work behind going into that? Because I think your viewers especially would appreciate knowing sometimes there's a tremendous amount of work that can go into putting together a video, from the research to the editing and all of that.
Yeah, for sure. And so I do kind of like a blend of different style videos. I do a lot of reaction videos to content. A lot of people are going to know me from Sarah Boone. I mean, that just kind of wrote itself, that scenario. And then I'll do other things like I don't know if you want to call it storytelling, but just talking about a case and whatnot, or commentary, things of that nature. But regardless of them, for me, what I have to do is find something that interests me. That's the first criteria or whatever, where I'm like, what is this? It makes me stop in my tracks kind of a thing. So that's the first thing. And then once I go into it, I find different dynamics of it. Now, when you want to talk about like the technicalities of, editing, recording, all that kind of stuff or whatever. Yeah, to me, that's where I'm like, I guess you could say like content creation of any kind really is just time consuming. You know what I mean? Where it's like, like editing, I'm like, oh my gosh, like that part is so. Now I have people that help me with that at this point, but I still do edit some other stuff and whatnot. But that would take me hours to do, like just sitting there and going through it. And I'm also, I'm not no spring chicken, so I don't know how all that stuff where I do stuff where probably like a 22-year-old would be like, why don't you just press this button that does that instantly? And I'm like, are you kidding me? I spent 8 hours doing that. You know what I'm saying? That's my life story. So probably when I'm saying it takes 8 hours, like a younger person would be like, yeah, that's like the click of a button. But it is what it is, right? So yeah, between all that, like a video, that can take, and it depends, like, I would imagine like if you're talking a Stephanie Harlow kind of video, that takes her like a week to do. You know what I mean? I don't know personally, but like that's like super in depth. For me, it like a typical Sarah Boone reaction thing could be like a day or two, depending on how in depth it was or whatever. But yeah, it's definitely time consuming, but it's also interesting. I think with true crime specifically, if it wasn't interesting on some level, it would be awful because the stories you're reading, it's just they're about terrible people most of the time doing awful things to decent people. You know what I mean? So it's almost like there has to be some interest level in it to like enjoy doing it, I guess is what I'm trying to say.
Talk to us about that interest. What do you find are the cases that fascinate you or the cases that you gravitate towards?
So I feel like I gravitate towards like a couple of different things. Usually I will find interest in the absurdity of some aspect of the case. And again, I keep referencing Sarah Boone, but it is what it is.
Talk about absurd. That's a great case to reference. Yeah.
Come on, right? So there's two different things, like something absurd like that, because at my core, I have I come at life with if you don't laugh, you'll cry your eyes out kind of vibe. So I come at life through a humor lens and whatnot. So I'll find humor in some things, like with Sarah Boone and the ridiculousness of her actions. Now, also at the center of that, whether it's her case or other cases, whatever, there's also, what I just call the human dynamic of it. So when you start looking at the victims and then what they went through, at the hands of some of these absurd people like Sarah Boone, like the life that George probably unfortunately was living or had, went through with her, and the psychology behind it. I'm very fascinated by that dynamic of it, and how the human brain works, how we each go through different things, and how we those resonate with us, we overcome them, and that type thing. So it's usually those two different things that will attract me to a case.
You, one of the things I appreciate that you do is that you always kind of begin your videos by saying, I'm not a lawyer, I'm not a doctor, I'm not a psychologist. Like, this is just you trying to give the facts. But why? Tell us why that's important to you to explain to people, and why, what is the lens that you're trying to bring to these conversations?
So for me, like when I say that or whatever, there's a couple of things going on. So like if you take you, for example, like you've gone to school, you've done this, you have like this degrees. I mean, these are very difficult to get. And so you have that level of perspective, education, and all that to go through. So one thing I started seeing early on is where in the comment sections, people would be like, wow, almost like referring to me as a lawyer and whatnot. I'm like, oh my God, like,
yeah,
absolutely not, right? Like, I do not know what I'm talking about. Okay? Like, these are literally my opinion. Because in my world, when I make the videos, I am still sitting on the sofa with Matt with the remote, just talking from the sofa, right? You know,
Right.
That's what I'm doing. So I'm just like, look, I don't know any more than you do, right? And that's one thing that I try and make clear, because, you know, at the end of the day with these cases and stuff, like, we don't know. Like, we weren't there. We weren't the victim. We weren't the perpetrator. We weren't on the jury. You know what I'm saying? So it's like we and what I mean we is like the viewers and people like that. We're looking at it from that perspective. So that's why I always like to make sure where it's like, look, I don't have those credentials, right? It's just me and the sofa. And my opinions based on that. And so it's just big to me, almost like out of respect to people such as yourself who do have those credentials, but then also just as like a do your own research kind of thing, right? Don't believe it. Like, it's just my opinion. Like, I'm just Paul, you know,
Yeah.
so
Yeah.
that kind of thing. Yeah.
Well, the reason I like that you highlight it too is I think it does. I think this is a space where anybody can kind of have some thoughts and perspective on it. And you don't necessarily need to be a lawyer or a doctor to weigh in on some of these subjects. That this is just kind of, you know, we're talking about human stories, and we're all humans, and this is your unique human experience that you're bringing to this story and how you feel about it. So I appreciate that you kind of highlight that in your videos. Let's take a step back though, because I do want to talk a little bit more about the journey. So I didn't want to fast forward through all of the starting on your couch. Here's a video. Tell us a little bit about that journey from where it goes from a fun hobby, a creative outlet, to now it's taking up more of your time. What were you doing in your day job during all of that, and where has that landed you now?
So prior to, and I would say prior to, YouTube has been overlapped with, like, I don't know how you would say it, like a regular job or, you know, whatever, for the whole time, basically, until recently. So I've done several things. I mean, I've worked at salons, I've done usually creative type stuff or management type stuff. And my most recent thing is I was working at, I don't know how you would say it, but places that do credentialing for people with, you know, like yourself, attorneys, doctors, things like that, like professional testing, things of that nature. And so there I was working around very nervous people all day long that are taking life-changing examinations and whatnot. And so that's really what I was doing there. And then also doing the YouTube thing. Now the YouTube, and I'm trying to even remember, because I'm also going back to that, like, you know, 2020 time zone there, where work was kind of crazy because everything shut down. And then it was like, okay, we're kind of rebuilding, like, at least in my company, you're having to travel to DC and do this crazy stuff. And then the background doing YouTube stuff at the same time. And that just, I look back on that time and it was so busy and so crazy. And again, you know, like I was talking to you, I've always loved being like, I loved my job and whatnot. Like, it was really, really fun. And I like the people. I like going and not talking about true crime in those moments, you know what I mean? And having like a different vibe going on during the day or whatever. But then as this got busier and busier, and then personal life got busier and busier, that became less of like I don't know how you would say it, like, it made more sense to focus on content creation and things of that nature and whatnot. And almost like a thing of like going out there on that limb type situation. You know, I mean, I would love to still like write a book one day. I would love to go back to school. I would love to I've actually recently looked into going back to school for a law degree, you know, things of this nature and whatnot. I don't know if I can handle that at this point, but you know, so I was just sitting there. I was like, okay, Paul, you either need to like kind of jump off the cliff of the unknown and just go for this and see where it goes, or real things in and restructure life, you know, because I was kind of burning the wick at both ends, as they say, and something had to give. And so, yeah, so there's that.
Did you ever reach a point where you thought that you might give up the YouTube thing and just be like, you know what, this is a hobby and it was fun, but I've got way too many spinning plates going on in my life and I've got to kind of concentrate?
Oh, like 10 minutes ago.
Right.
Like at 8 o'clock this morning, 10 o'clock this morning. Yeah. I go through, I mean, that's the roller coaster of my life right there. Yeah, 100%, definitely. Because again, I didn't start off in YouTube as thinking it would be literally really anything. And even now, I guess because I don't know how to say it, like it's not that I don't consider it real, but it's like a little bit of that, you know what I'm saying? Like where to me, I'm kind of like, oh, well, this is cool right now, but it's like a resting place in life, if that makes sense, you know?
Sure.
And I don't know how to explain it. I never meant for this to happen. And so now that I'm here, I'm like, oh, cool. There's definitely things in this realm that I would like to explore. Like I said, you know, going back to school for a law degree or writing a book or whatever. But yeah, I mean, I can remember like when I hit 2,500 subs, and I mean, that was like, the 2,500 people subscribe to my channel, please. Like that was like, I was, you know, Tom Cruise and I was like, please, like that's that level of fame, right? And
Right.
we got a cake and we did, I mean, all the fun stuff and whatnot. And I mean, I can remember it leveled out around there and I was like, oh, okay, well, this was cool. Like, you know what I mean? Like, this is what this is. It's my hobby. I did this, you know, great, you know, make a little bit of money, pay for some groceries here and there. And I've met all these cool people. I can conversate about true crime. So it's always morphed along the way to something I didn't ever anticipate it being. So, yeah.
What, tell us about, some of the stuff that has surprised you in this journey. Like what was some things that you weren't expecting, either good or bad?
And do you mean like with cases or life or like what?
I guess both. I guess, you know, because the theme that I'm getting from you is that you kind of have followed this without and I don't mean this, I mean this in a very flattering way, but kind of followed it where it takes you rather than trying to lead it somewhere. And I'm curious, as you've kind of been along for the ride, have there been things that have surprised you? Like you, for instance, you said that you were surprised, I think, a little bit by kind of the response from people at true crime. Have there been some things that maybe have surprised you as far as them being more of a struggle than you anticipated, or just only good stuff?
So, yeah, so a few things come to mind. So, first of all, like as I was doing this and whatnot, like I guess getting like spotted out in public, and it hasn't happened that much, but like these very bizarre random times, which are flattering, like being in the mountains of North Carolina at a grocery store at a Piggly Wiggly, and somebody recognized me and being like, "What? Like that's so weird." But you know, totally cool. Then at work too, I try to keep that very separate and never told anyone about it except my regional manager. And so literally I would like put these blinders. I can remember coming into work one day and one of my coworkers being like, Paul, I tried HelloFresh. Have you ever tried that? I really like that. I've done sponsors for it. It was like so random. And in my mind, I was like, they know that they've watched me. But me completely not acknowledging, I'm like, I love HelloFresh. It's really good. Okay, so here's the list for today. You know what I mean? And just pretending like that. And everybody coming to me for true crime, but no one talking about it.
Right.
Because at one point, like with me being the boss, I was like, I don't know how that works. I don't know if that's, you know what I'm saying? Like,
right.
And then people, like when the lawyers would come in, like we would do these mega testing events for attorneys. And that would be the days where people would be like, oh my God, Paul, like, what are you doing here? Like, I watch your channel. Those kind of things were like, oh wow, this is real. You know what I'm saying?
Yeah.
Now another thing is when we would go to true crime and we would plan up these like little meet and greets, like, especially like even the last one. And my friend Derek, shout out to Derek, he helps me along with Emily and everybody there. And we would plan a meet and greet. Well, I would be shocked when people were there. I was like, oh, people actually showed up to this. Like, to me, it's so weird, right? I'm like, why would anybody want to hang out with me? But then like even at the meet and greet, we would be sitting there and like at the thing, like there's people hanging out and you're going around talking to people. And like this one couple, I felt so bad, but I thought that they were just sitting near the group and they ended up talking to people in the group. And so I went to talk to them. They're like, no, we were here for you. And I was so surprised. I was like, oh, I just thought that I didn't think that, I mean, like,
Right.
it just surprises me that people would want to talk to me. And I guess I'm like divulging my like low self-esteem or whatever. Right. But it's just, so that dynamic of it where people are like interested in it and like, oh, we want to engage with you. And that kind of stuff has been, kind of surprising to me in a good way.
That's fantastic. I'm glad to hear that you're starting to get a little used to it, and I think you should, because people obviously are responding very positively to the stuff that you put together. Talk to us. People are curious. First of all, also a shout out from the Courtroom Confidential community that we've built, because your name had come up more than once as somebody that they wanted to hear from. So thank you again for doing this.
No, cool.
But one question that we get from people sometimes when doing these interviews is they want to know kind of what is a typical day or work week look like? Do you have it kind of structured? Okay, I know I'm going to do this video and I'm going to do a live on that day. Or are you just shooting from the hip every day and just kind of responding to what's happening?
So yeah, for me, I shoot from the hip. Every day is completely different. I've usually got a lot of stuff going on in my personal life and whatnot, which has kind of like been pretty heavy the last couple of years. And so it's kind of like a juggling a bunch of different things. I'm trying to going into this year, structure things more with like a solid upload schedule on the main channel, solid live chat channel, or upload or whatever, a live chat stream on the live chat channel. So that's really what it is. But I mean, so usually every day I record something, and whether it's for whatever, but yeah, every day I record something, and there's usually like a overlap, obviously, of doing some kind of research and whatnot. And so I'll have several different things going on. So like right now, for example, like I'm very much watching the Natalia Gray stuff that's been going on, as well as reading Sherry Frankie's book, doing stuff on that, as well as making timelines for the Megan Boswell trial coming up that I'm going to go attend. So I have like these several things that I know are taking place that I juggle. And so I probably work harder, not smarter, if that makes sense, because then there's also in that mix of, well, what interests me? Like I'm not good at being like, oh, pretend like topic A is trending over here, you should do that. But if it doesn't interest me, I'm like, I kind of gravitate to whatever is like currently just of my interest and whatnot. So yeah, I just end up kind of all over the place. And I think that people come to expect that of my channels, where it's like, look, we don't know when he's going live again. It can be whenever. And so I'm trying to reel that in the coming year and moving forward of like, let's get down to like a solid pattern and make a commitment to that.
I'm so glad to hear you say that about how you kind of only cover things that interest you rather than trying to anticipate what it is that people are looking for, because it creates a unique voice in you, because sometimes you might be exposing people to cases they don't know about. There seems to be always that ongoing big case that's in the news that everybody's talking about. And sometimes it's refreshing, I think at least, to see other channels that say, hey, I found this little kind of not overlooked case that I think is fascinating, and here's the reasons why, and you'll find a really positive response to that. So I guess my question is, you mentioned a few cases. If you could tell us a little bit more about what is coming up that really is something you feel like you're going to be putting some time and effort into talking about and covering. You referenced a couple of cases already.
So a couple of things going on. So there's a local case to me. Again, I'm in North Carolina. Avante Devon is in Fayetteville, North Carolina. She is currently incarcerated. She is awaiting trial for some very heinous charges in relation to 2 of her adopted children. It is literally like one of the most next level things I've seen. And it just keeps unfolding. So she has a hearing Thursday, I think, that I'm going to try and go to. So that's like at that stage in the game. You know what I'm saying? Like at that level. Like I said, Megan Boswell. I would actually like to really try and go out to the Lori Vallow trial in Arizona. One thing that I'm trying to do this year is to actually go to the trials and hearings of these ones that I'm able to do now that I can kind of travel a little bit more. And do that perspective of it, especially in the frame of mind of being like, well, maybe I'll go back to school for a law degree and whatnot. I feel like that would be the next step is like, okay, Paul, you need to actually like maybe attend these hearings and go to these things and get that level of a perspective on it. And so, yeah. So then like, like I said, other cases, I'm deep in the trenches of Sherry Frankie's book. Oh my gosh. Absolutely. So glad that she wrote that book. I'm so proud of her for getting her story out there. And I've connected to several things in it that I'm like, oh my gosh, this is why I love people sharing their stories and whatnot.
Tell us a little bit about that case for people who might not be familiar with it.
Yeah, so Sherry Frankie is the daughter of Ruby Frankie. Ruby Frankie, her co-defendant, if you will, Jody Hildenbrandt, they are currently incarcerated. Ruby Frankie was the host of 8 Passengers, a very viral family vlog channel. And then her and Jody met up and it was like the evil forces joined and it, horrible things took place. One of Ruby's children escaped from Jody Hildebrandt's house, malnourished, lots of, very bad things done to them at the hands of Jody and Ruby. And so Sherry Frankie, the daughter, published her memoir.
How old is she?
I'm not sure how old she is at this point. I mean, she's in her 20s, something like that. I mean, she's an adult.
She's got to be young. Yeah. But she's got to be
still
young, right?
young.
I mean, yeah.
So, but she published her memoir and it's really the lens of like, this is what it was like. To me, it's 2 lenses. Growing up in a YouTube home against my will, and you're getting that perspective of a child who's like, oh, mom started this YouTube thing. Well, life will go back to normal at some point. And like, as we know, it certainly didn't. And then the perspective of growing up at the hands of an abusive, mother, and then eventually a mother in Jody. So you have these multiple layers going on and it's so beautifully articulated, especially if you've been with your writing stuff as well, would appreciate how she tells the story. She narrates the Audible book. That's what I'm doing. Or that's how I'm, reading it or whatever you want to say, listening to it. And it's just a beautifully written story that's also absolutely tragic and heartbreaking at its center.
Wow. Yeah. I did not know that she had that out. I'm going to want to check it out because I do feel like there's a lot more to that than people know. Like I followed it superficially enough to know that, oh God, this horrible situation. And they, the irony of the fact that they had a YouTube channel all about childcare, but they're doing all this deep, dark stuff behind the scenes. So I will definitely check that out. You kind of skipped over this, but referenced it shortly earlier before that you are at a point now where you've made a pretty significant career change as far as your day job to your YouTube job. Can you share with us what has happened recently for you and what does that mean for you with the future in the channel?
Yeah. So as of so really like last month or whatever, I officially gave my notice at my regular job, if you will. And like
congratulations.
Thank you. I appreciate it. Especially people who follow me for a long time will know, like when it first started and like we would be watching a trial or whatever, it was almost a given that if I was like, I either have to work or I'm going to go cut the grass, that is when a major bombshell in a trial would happen. Like the verdict's in or what, like it was like always that. And people would always joke about it. And it was like what I became known for, whatever. So as I was going with my job, and again, it was really bittersweet because I just started, I stepped down as the manager. I cut my hours back the more and more I got busy with YouTube. And I was leaving it at I'm going to just come in a few times a month or whatever. But then in inevitably those days something major would go down. And it was like, especially now with more traveling coming up, it was like, okay, I'm going to come in and say XYZ. Well, then it'd be like, well, now I have to go here. And I really just sat there and was like, you know what, Paul, I know what it's like to, manage people, be in charge. And I'm going to now become that pain in the butt of constantly rescheduling. And so I was like, what is best for the business? And I liked everybody I work with. I consider them my friends, and my managers, not like literally the best people I've ever worked with. And so I was like, I don't want to do that to them, and I don't want to become that unreliable person that's constantly changing and constantly doing that. So I kind of bittersweetly was like, you know what, I just need to step away, and then I can always go back to it. And so in doing that, that's where I'm also now like, okay, I want to go more boots on the ground. I want to really like kind of look into some of where my interests are going with this, which is like really getting deeper into some of the cases that I'm doing, looking into, potentially going back to school for a law degree, like those type things. And like, that's where okay, I'm going to try and go to these trials and, these hearings that are coming up, and really experiment around with that and take it to that level and just kind of see if that's where that needs to reside, or if I just need to stay in my little studio room.
Now, Ms. Hanley, when we left off, you were discussing the comparative analysis you did between item 7-18.18, Mr. O'Keefe's clothing, and item 3-1, the taillight housing, or the plastic within the taillight housing of the defendant's car, correct?
Correct.
And there were a number of different instruments that you used through the course of your examination and analysis, correct?
That's correct.
And what were those instruments that you used again in that portion of the analysis?
Sure. So I used a polarized light microscope, a comparison microscope, an FTIR, and a microspec.
And Your Honor, may I approach?
Yes.
Showing you 3 documents, if you could review those with Dr. Finch, please. And do you recognize those?
Yes, I do.
And starting with the first page of that 3 pages, what do you recognize that?
It is the FTIR comparison data for the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
If I could direct your attention to the second page within that, what do you recognize that?
So this is also FTIR
Showing you 3 documents, if you could review those with Dr. Finch, please. And do you recognize those?
Yes, I do.
And starting with the first page of that 3 pages, what do you recognize that?
It is the FTIR comparison data for the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
if I could direct your attention to the second page within that, what do you recognize that?
So this is also FTIR comparison data from for the red plastic from item 3-1 and item 7-18.18.
And lastly, the third page within that set, what do you recognize that?
So this is the comparison data from the microspec from the red plastic from the item 3-1 and the red plastic from 7-18.18.
Your Honor, the Commonwealth will seek to introduce and admit as the next two exhibits individually.
No objection, Your Honor.
All right, thank you.
You want them marked individually or you get a set?
Individually, please. Thank you.
Exhibits 202, 203, and 204.
Thank you.
And again, Ms. Hanley, when it came to your analysis of the clear plastic material from the debris from John O'Keefe's clothing and the clear plastic material from the defendant's taillight, what were your conclusions from that analysis?
Sure. Upon comparison, the clear plastic from item 7-18.18 was found to be consistent in color and instrumental properties with the clear plastic from item 3-1. Accordingly, the clear plastic from 7-18.18 could have originated from the clear plastic from item 3-1 or from another source with the same characteristics.
Thank you. Your Honor, may I publish, and I'm sorry, I forgot already the
Yes.
exhibit numbers, but
Yes.
Ms. Gilman, if I could have the clear plastic. And Ms. Hanley, can you describe for the jury what we're looking at in this, what's up on the screen right now?
Sure. So this is the FTIR comparison data of the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
And Ms. Hanley, if you could, using the laser pointer before you, if you could direct the jury's attention to which is which as far as the top and bottom.
Sorry. The top,
Sorry, I apologize, Your Honor.
That's okay.
the top spectrum is item 3-1 and the bottom spectrum is item 7-18.18.
And Ms. Hanley, when you're comparing these two as far as the data that you receive, what is it specifically that you're looking at in your comparison as far as the data is concerned?
So when I'm comparing the spectra, I'm looking at the peaks in each sample to determine if they are consistent or not consistent.
Thank you. And if I could turn your attention to the red plastic material from the debris from Mr. O'Keefe's clothing and the red plastic from the passenger side taillight of the defendant's vehicle, what did you conclude in your analysis there?
So upon comparison, the red plastic from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the red plastic from item 3-1. So accordingly, the red plastic from 7-18.18 could have originated from the red plastic from item 3-1 or from another source with the same characteristics.
Thank you. And Ms. Gilman, if I could have the red plastic data. And Ms. Hanley, directing your attention to the screen again with the laser pointer, if you could delineate for the jury as far as which set of data is associated with which item?
So the top spectrum is item 3-1 and the bottom spectrum is item 7-18.18.
And again, if you could just direct the jury's attention with that laser pointed to the areas as far as the data peaks and valleys that you're looking at in comparison of this data.
So when I'm comparing them, I'm comparing the peaks to each other in each of the spectra to determine if they are consistent or not consistent.
And in this case, you found them to be consistent. Is that correct?
That's correct.
And Ms. Gilman, lastly, if I could have the microspec data. And Ms. Hanley, if you could describe for the jury, please, what are we looking at in this particular data set?
So this is the comparison data from the microspec of the red plastic from item 3-1 and the red plastic from 7-18.18.
And as far as the data in any microspec, but particularly this one up on the screen, using that laser pointer, could you illustrate to the jury sort of what these individual lines or what this data means?
So these are the samples that I ran, and they samples that I ran from item 3-1 and 7-18.18, and the spectra are overlaid in order to determine, to look at it and to determine whether they have a consistent or not consistent pattern.
And from overlaying the data from the pieces of plastic from Mr. O'Keefe's clothing and the pieces of plastic from the defendant's taillight, what do you observe as far as from overlaying those two sort of data points?
So I determined that they had consistent microspec data.
Again, if you could just remind the jury as far as the microspec data, what type of data is that?
So the microspec, it analyzes samples that have color. So it provides information of a sample's dyes or pigments.
Thank you very much. Ms. Gilman, you can take that down. Thank you, Ms. Hanley. I have no further questions, Your Honor.
Okay.
Good afternoon, Ms. Hanley.
Good afternoon.
Nice to see you again. We met about a year ago. First things first, you were just talking about some plastic pieces in 7-18.8, correct?
It was 7-18.18.
0.18, I left a 1 out. 7-18.18. We're dealing with a lot of numbers. I'm going to see if we can cut through that here in a second.
Sure.
First of all, you indicated that you were doing a comparative analysis in different sort of different categorical ways, using microscopy, using the microspec, using the FTIR. I think you also use the FTIR in that as well.
Yes.
And you indicated that your analysis concluded with those pieces could have come from the same source, from the source that in 3-1, the taillight. But you're not conclusively saying they did, correct?
It could have come from, they could have a common origin, or it could have come from another source with the same characteristics.
Right. So in other words, another way to say that, Ms. Hanley, is it may have come from the taillight, may not have.
It's a possibility.
Okay. I also want to ask you real quick about the taillight manufacturer. You were shown an exhibit, I think it's exhibit 200, and I think we have that available. With the court's permission, we don't have to cut the lights. I think the lighting is just fine. This is exhibit, or a photograph of exhibit 200 that you saw just a second ago. Quick question about that. In your inspection of that taillight, it's true, is it not, that is manufactured entirely of plastic or plasticine pieces? There is no glass. in that taillight, correct?
I have to check my notes. I don't think I noted any glass.
Okay. So in other words, you didn't note any glass inherent in the manufacture of that taillight. It's basically plastic.
Yeah, I think most of the parts were plastic. I'm not 100% sure if the entire thing was plastic. There may have been other material, but portions were plastic.
But you certainly didn't see any glass inherent in the manufacture process.
I'd have to double check my notes, but I don't think I did.
Okay.
Do you want her to check her notes?
Why don't you? Are your notes in front of you?
Yes.
With the court's permission.
Sure.
Okay, so I did not make any notation that I noted portions that were glass.
Great. Final point before we get into the actual analysis. On any of the glass, I want to shift gears to just the glass material that you analyzed and that you looked at and you inspected. You saw no blood, no skin, no biological material, no tissue, human tissue or otherwise, on any of those pieces that you inspected, did you?
Upon examination of those items, making observations of those types of material, that's not my area of expertise. I don't think I noted anything that was maybe consistent with that.
So in other words, even though you're not in the bio material expert section of the lab, you certainly would have noted if there was skin or biological material or obvious blood on glass pieces. You're looking at them in many cases through a stereo microscope, correct?
Yes, I would have made note of observations of anything that I would have noted on the surface.
Great, and you did not, because you didn't see anything that was suggestive of that, right?
I think I just made note, I have to check each item, but I think I did note that there was some dirt debris on some of the items.
But not biological material.
I did not note anything that would be maybe consistent with that.
Great, thank you. I want to talk about the comparisons that you did. And you'll forgive me, I'm a visual learner. So I'd like to talk about it in 4 categories.
Okay.
Linear categories. Category 1, item 3-2. Category 2, item 3-3. Category 3, item 7-12. Category 4, item 7-14. 3, 2, 3, 3, 7, 12, 7, 14. Can we talk about it in those particulars?
Sure.
Okay. 3-2 was the cup, correct?
That's correct.
Okay. And I'm going to use the word cup rather than glass for obvious reasons. You can get confused by that. So when I say the cup, do you know what I'm talking about?
Item 3-2.
Great. 3-3 are the 5 items that were found on the bumper, claimed to have been found on the bumper by MSP or crime. Okay?
Yes.
5 items, A, B, C, D, and E, correct?
Correct.
Item 7-12 are 9 items, glass items, that were recovered at 34 Fairview by Trooper Buchanan in an evidence envelope, correct?
So sustained as to who they were recovered from.
Sure. Did you receive the items along with an evidence envelope?
I need to double check if it was an envelope, but I received it packaged.
Okay. And the packaging normally, under normal circumstances, the packaging comes with labels. It gives you reference about where things came from. For instance, when Mr. Lally asked you, were you aware or did you become aware that items were claimed to have been found on the bumper? You didn't actually find those items, but that was the description you were given, correct?
That was the description of the item in our limb system.
Okay. And going back to 7-12, that's our third category. Was that described as 9 pieces of glass that were found at 34 Fairview by a sergeant by the name of Buchanan? Or do you recall that?
I am not sure who recovered them.
Or what it said on the evidence envelope? That's what I'm asking.
I would have to check my photos to see if it says that.
We'll get to that in just a second, but fair enough. 7-12, 9 items, A, B, C, D, E. And if my memory serves, I, K, and L.
I'd have to refer to my notes to.
Can you please?
Yes. So the 9 pieces of glass from 712 were labeled A, B, C, D, E, F, I, K, and L.
Great. And then finally, what was in 714, that's an easy one, 1 piece of glass.
That's correct.
Okay. Your Honor, may I approach?
Yes.
If I could, Ms. Hanley, I'm going to hand you photographs. That should be 2 photographs of the exact same thing. Do you recognize what's depicted in that photograph?
I've never seen. I did not take this photo.
Understood.
So I'm not. I haven't seen them, so I don't know.
So I'm asking you to look. I know you haven't seen that photo. Does it look like the cup?
It looks consistent with the cup.
Okay. Just gonna set this aside for a second. Take a look at the second photo. Do you recognize what's depicted in that photo?
So I did not take this photo. It appears to be a photo of a container that another analyst took a photo of item 7-12.
And item 7-12, once again, included plastic pieces and 9 glass pieces, correct?
Correct.
Do you see the evidence label on the very top of that evidence envelope?
I'm not sure which label you're talking about.
One under the red tape.
Yes.
Does that appear to be a label marker that's done to maintain chain of custody?
So I think that label. Sorry.
Sure, can we bring these over to the side?
Sure.
Jurors, sometimes we're at sidebar in an effort to try and speed things up. So even though we take your time that way, this should make things move a little easier. So you can cut that from back.
Thank you. Ms. Hanley, I was asking you previously, we already looked at what's been marked for identification as triple G. I was asking you about what has now been marked as triple H. If you'll just look at that, what I'm most interested in is, do you see a name, a trooper's name in the middle of that evidence bag?
Yes, I do.
Is that Buchanan?
It looks like it says that, yeah.
Okay, and just so we're clear, that bag is associated with 7-12 of your analysis. The item 7-12, correct?
Yes, again, I didn't take this photo, but I have,
I
yeah.
realize that. It says 7-12
Yeah.
right on the photo.
Yes, yeah.
Okay, that's all I need. Taking a look at what's been marked as triple I for identification. Do you see a name associated with that evidence bag?
Yes.
What name is that?
It's actually a little hard to read. It looks like it says, it could say Trooper Proctor.
Okay, and that is associated with 7-14, our fourth category, correct?
It is labeled as, excuse me, 7-14.
Thank you. And finally, does that, which has been marked as, for identification at least, as triple J, does that appear to be the contents of that bag, which is a single piece of glass in 7-14?
This appears to be the photo that the analyst prior to me took of item 7-14.
And that would be analyst Valier.
Correct.
You see her initials there.
Yes.
Okay, thank you. So the four categories, just so we're clear and we can stop using so many numbers because they can get confusing. 3-2 is the cup, right?
Yes.
3-3 is the bumper glass, correct?
That is correct.
7-12 is the Buchanan glass, correct? You just looked at it.
Yes.
Okay. 7-14 is the Proctor glass, the single piece, correct?
Correct.
So when I make reference to those items by those names, you'll know what I'm talking about.
Yeah. Yes.
Hesitant.
No, I just, I'm just used to referring to them to the item numbers, but I will try to stay with you.
My brain will melt if we continue that way.
Can she do it both, Mr. Jackson?
Sure. Any way that you wish. I have another document that I would like to approach with, if I could, with the court's permission.
Okay.
Thank you. I'd like you to take a look at that. You've got a copy of this. Have you ever seen that before, or a variation of it?
Yes.
Okay. Saw it last year, correct? Or something close to it last year?
Yeah, it looks consistent.
Okay.
I'm sorry, may we approach on this?
Okay. If there are any others, Mr. Jackson, why don't we bring all the
This is it.
So I think I gave somebody the copy that I was using. I need a copy.
If I may approach?
Yes. Thank you. All right, so let's mark this first for identification.
Happy to.
KKK for ID.
Ms. Hanley, if I could ask you very briefly, I want to go through this chalk with you for a moment. Do you recognize something on the left, looking at the first category? Do you see 3-2?
Yes,
How is that described?
it's described as a cup.
Okay, and you see that there's a photographic representation of the cup just above it, correct?
It looks consistent with,
Okay. Moving to the second category. What category is that?
it's item 3-3.
And 3-3, first of all, there's a photograph above it. Do you see that?
Yes,
It appears to be of a bumper, correct?
yes,
You didn't take that picture.
I did not.
Okay, let's look down beneath it. You indicated that there were 5 items in 3-3, A, B, C, D, and E, correct?
Correct.
Do you see A, B, C, D, and E represented in that category on this chart?
I do see A, B, C, D, E categorized, yes.
Great. Under A, you previously testified that the bumper glass sub A in 3-3 did not match the cup, correct?
That's correct.
Did not match anything in 7-12?
Sorry, just give me one moment. That's correct.
And did not match anything in 7-14?
That's correct.
And you see those represented by sort of the international symbol for negative, correct? A circle with a line through it. Correct?
Yes.
Okay. Under subcategory B, glass B, or item 3-3B, did not match the cup, did not match 7-12, did not match 7-14.
That's correct.
Is that accurately represented on the chart?
Yes.
Finally, with regard to E as an echo in that same item, 3-3, you see that there is a green indication that glass recovered by Proctor does match or did match in your analysis, or was consistent with the item in 7-14, correct?
It was consistent microscopically and instrumentally.
Does that accurately reflect that finding on this chart?
Yes.
Okay, now turning to category 3. There were 9 pieces of glass that you looked at, correct?
Correct.
A through F, I, K, and L. Is that right?
If I could just reference my report to make sure.
Of course.
Yes, those are the correct letters.
And A, B, C, D, F, and K all matched the cup, correct?
Again, I would just need to confirm with my report.
Take your time.
Yes, so A, B, C, D, F, and K
All matched the cup.
had a physical match to 3-2, the cup.
Is that accurately represented on this chart? With green.
Yes.
And E is an echo, I is in India, and I think that's L is in Lima, did not match the cup, correct?
That's correct.
Okay, is that accurately represented on this chart?
Yes.
And finally, the last category, 7-14, that is the single piece of glass that was recovered by Trooper Proctor. That did not match the cup, and it did not match anything in 7-12, correct? to check your notes, feel free.
Yes, that's correct.
Is that accurately represented on the chart?
Yes.
Your Honor, I would move for the admission with the amendment that the court indicated at sidebar of triple K.
Okay, I'm going to allow it in.
205.
205?
Yeah.
Your Honor, the court indicated that it would like to see us before anything's published to the jurors.
Hey, come on over for a second. Actually, have those have those been done?
It has been done, and
Okay.
I was going to explain at sidebar.
All right, then come on over. $205.
Thank you. Request permission to publish.
Yes.
Ms. Hanley, you see the chalk that's been, or actually what's been marked as Exhibit 205 in evidence on the screen?
Yes.
Is that consistent with what you and I were just talking about at the witness stand?
Yes.
If you'll direct your attention to the screen on the right, just because it's a little easier and I think the laser pointer shows up a little better. You see the 4 categories represented in this exhibit?
Yes.
Okay, so 3-2, I'm going to go over it very quickly one more time, just visually. 3-2 on the left is the cup, correct?
Yes.
3-3 represents the 5 pieces of glass of what we call the bumper glass, A, B, C, D, and E, correct?
Yes.
7-12 is the 9 pieces of glass recovered by Trooper Buchanan at 34 Fairview, correct?
Yes.
And finally, 7-14 is the single piece of glass recovered by Trooper Proctor, correct?
Yes.
Taking these one by one, just so everybody see. Taking these one by one, looking at starting with the bumper glass, category 2. Piece A did not match the cup, anything in 712 or anything in 714, correct?
That's correct.
Piece B did not match the cup, did not match anything in 712, did not match anything in 714, correct?
That's correct.
And moving over to category 3, there were some matches in these 9 items, 6 of them, A, B, C, D, F, and K, correct?
Yes.
But what those matched, Ms. Hanley, were the cup, nothing on the bumper, correct?
Correct.
And what didn't match the cup were E, I, and L. Is that right?
That's correct.
Moving back to category 2, however, there was one thing, item E, that did match something in this series of categories. Isn't that right?
not a physical match, but instrumentally there was consistency.
All right. And this was an item, the only piece of bumper glass, the only piece of bumper glass to match anything else in your analysis. Matched what? It was consistent with what?
So item 3-3, piece E was consistent in physical and instrumental properties with the sample that I took from item 7-14.
Which is the single piece of glass recovered by Michael Proctor, correct?
Yes.
But not a single piece of glass, nothing that you analyzed coming from that bumper matched the cup. Did it? Nothing.
Physical match comparison, there was no physical match comparison to the cup.
Are we done with this, Mr. Jackson?
We can take this down, Your Honor. Your Honor, that's all I have. Thank you.
Mr. Lally?
Now, Ms. Hanley, as far as you were asked some questions on cross-examination about biological pieces or tissue or things being on the glass, and you referenced that that was done in another unit, correct?
Yes, if that type of examination was needed, that would be done in a different unit.
Objection, Your Honor.
I'm going to allow that, but next question.
Which unit would that be conducted in?
Objection.
So the objection sustained. You need more, Mr. Lally, before you move on.
Now, as far as the chalk that you were just presented, as far as the 4 photographs that were depicted in there, have you ever seen any of those 4 photographs before?
No.
Do you know specifically who or where any of the items 3-2, 3-3, 7-12, or 7-4 were physically recovered from?
I just have the description that's put in the limb system when it's submitted to the lab.
And do you know that 3-2, the drinking glass, was recovered by the Canton Police Department on January 29th, 2022?
Objection.
Sustained.
Do you know that item 3-3, the bumper glass, was recovered by Ms. Maureen Hartnett from your lab on February 1st, 2022?
Sustained.
Do you know that each of the 4 items were recovered by different people on different dates at different locations?
No approach.
Yes.
Now, Ms. Hanley, from your conclusions that you testified about before, you found that the item 3-2, the drinking glass, was consistent with 6 different pieces from item 7-12 that were found in the roadway outside of 34 Fairview Road, correct?
That's correct.
And you also found that piece E from item 3-3, the bumper glass, was consistent with the single piece from item 7-14 that was found in the roadway outside of 34 Fairview Road. Is that correct?
Yes, that's correct.
And you also found that items from 7-18.18, the debris from Mr. O'Keefe's clothing, were consistent with the item 3-1, the taillight housing, correct?
Yes, Your Honor.
Sustained as to form.
Now, as far as the chalk that you were presented with on cross-examination, was there anything in there about item 7-18.18 or item 3-1, either the taillight housing or the debris from Mr. O'Keefe's clothing?
No, there was not.
Nothing further.
Anything?
Very briefly. So in sum, not a single piece of glass on that bumper could be connected to that cup, correct?
There was no physical match to the pieces that I compared for physical match from the bumper. There was no physical match to the glass cup 3-2.
Thank you. So another way of saying that is not a single piece of glass that you analyzed on that bumper match that cup, correct?
Sustained.
But the one piece of glass that did match something came from the same source, or was consistent with coming from the same source as the single piece of glass recovered on the possession of or bagged by Trooper Michael Proctor, correct?
It was consistent with item 7-14.
That's all.
All right, Ms. Hanley, you are all set. I'm going to see counsel for a minute. Jurors, feel free to stand up and stretch. All right, so jurors, I know you don't like it when we're at sidebar. We don't like it when we're at sidebar, but I can tell you that after speaking to the lawyers now, we're ahead of schedule. And they've worked very hard to get us to this point where we're ahead of schedule so that tomorrow, instead of being a half a day, you have tomorrow off. So you have tomorrow and Friday, a good long weekend. It's very, very important. Do not discuss this case with anyone. Don't say a word about this case. Don't let anybody say anything to you about this case. Don't do any independent research or investigation into this case. If you happen to see, hear, or read anything about this case, please disregard it and let us know. I believe next week, except for Thursday, are full days every day. Watch your social media use this weekend as well. Have a great long weekend. We'll see you here Tuesday morning, ready to go.
Court, all rise to the jury.
Goodbye.
So no one needs to see me about anything? We get cleared up.
Put on the record that what's been marked for as actions that entered into evidence 205, we're in the process of printing a new one. The one that actually went into evidence is not the one that we showed.
Okay.
Instructions. We'll get that printed to you. I think before we leave. I think he's printing it now.
All right, I'd like it before we leave. So, before you leave, so. All right, have a good weekend.
Thank you, Court, all rise.